So cure in breast cancer is a tough term. Patients will often come in and say, "Doctor, am I cured?" We more often like to talk about cancer in the terms of remission. So remission is a situation where the cancer is no longer evident in the body. In breast cancer, if we tell a patient they have a recurrence, there are a few different kinds. There's local recurrence, so there's a recurrence of the disease in the breast. Or there could be distant recurrence, which is worse. That's stage 4. So that's disease that's recurred outside the breast area. If you have disease in the liver, in the lung, in the bone, that is distant recurrence. Most people consider early stage breast cancer a cancer when, if there is a tumor that is less than 5 centimeters, and if there's disease in the lymph nodes, it's minimal disease. It's not where you have 10 nodes with disease. So when someone's diagnosed with breast cancer, they have a lot of people that become involved with their lives. They are seeing a breast surgeon, probably a medical oncologist, and a radiation oncologist often. So they'll be seeing those doctors at varying rates. Most surgeons see patients every 6 months for at least the first 2 to 3 years. Some patients are followed every 6 months for 5 years. Once they hit the 5-year mark, they usually will move on to following up with either a primary medical doctor, or sometimes they'll go into a high-risk or surveillance program where they're seen once a year so that their studies can be ordered and they can be monitored going forward. There are many women that really struggle with the fear of recurrence. So I think a good place for a woman to start is to talk with her doctor, because we have resources that we can reach into to support the patient. We can give her the names of therapists that she can speak to. We can get her into a support group. We can hook her up with our social worker who can really sort of dive in deep and figure out better ways to help that patient manage her anxiety or fear about having a recurrence.